Grand Bahama, they're going to be proud of their new hospital.
We are seeing the near completion of the first phase of our renovations. And within that first phase, we will have the pediatric unit, we will have the foyer area, the main entrance to our hospital, the main hall, the thoroughfare to our hospital that connects us back to the emergency room area. And we will also have our pharmacy services, a very important department for our community. The next part of the construction, which should be delivered to us in early to late November, will be our main clinical corridor. And within that main clinical corridor, we have our obstetric area, we have our neonatal care area, and that is our special care baby unit. We have our ICU, and we have the medical surgical ward, which definitely represent the majority of the adult population within our hospital. We will see the beginning, and a large beginning I should say, of stability again in the hospital for admissions.
With the new isolation facility, is basically a 4-room facility with a 7-bed capacity. So not just COVID patients can be addressed, but also patients like tuberculosis who also require isolation. Patients like that can also be addressed in a specific ward and not impact some of our regular patient ward or patient space as it did in the past. The intensive care unit now will have the capacity for individual beds for patient care, as opposed to a Nightingale style ward. Within each room, you will have the capacity to isolate a patient if there is a need to isolate a patient while they still need intensive care management, and also to dialyze a patient. Another big part of our renovation is where we are presently, the operating room facility. And some of us may know this facility is being renovated back to its where it was when it was built in 2011, and that is a 4-room operating suite. And it allows us, or gives us the opportunity, once we have the necessary bed capacity, to have quite a few visiting surgeons. And I think that is something that the island of Grand Bahama can benefit from.
During all the construction, everything had to be removed out of the area. The spaces was totally empty. So all the wooden studs had to be replaced. All the flooring, the walls, all had to be replaced. And we built back a little stronger and better for the patients. The patients now, each bed will be equipped with oxygen and med gas. Rooms, you'll have rooms with 2 beds, some with the main areas. You'll have like 9 beds and 2 of the dorm areas, and adequate spacing between beds for patients. The new 3-story complex for the hospital, that should be about 5 feet above street level. In case of flooding, that water don't come in back into the hospital. Grand Bahama, they're going to be proud of their new hospital.